Well, thanks for staying with News at Prime tonight. A poll by Thomson Reuters Foundation has found that work-life balance and the gender pay gap lead the list of critical concerns for women in the developed world. Well, to speak about some of the challenges that face women, especially as we celebrate Mother's Day, aesthetic gynecologist Dr. Natalia Novikova is going to be speaking to us about policy reforms in particular targeted at ensuring women have better access to healthcare. And Dr. Natalia, it's such a big issue when it comes to the quality of life for women in general, in particular in this country, that the access to quality healthcare services is simply not up to scratch.
Absolutely. Unfortunately, in South Africa, majority of population, and including female population, accesses government-based healthcare, and only minority of medical practitioners work for government healthcare. However, minority of women access private healthcare where majority of practitioners work. So it's actually 80-20%. And that really complicates the situation as access to the healthcare is very poor. And on the top of it, the awareness of medical basically conditions that we can help women with is also poor.
Let's perhaps outline just some of the key medical issues that women generally in this country tend to struggle with. Some of the latest data coming out of Stats SA listing breast and cervical cancers top of that list. We also have a great deal of women who are living with HIV/AIDS.
Absolutely. Cervical cancer is a huge issue in this country, and it's a preventable cancer. It's very difficult to treat advanced cervical cancer. However, in early stages, it's a very easy condition to handle, especially in preventive measures. If women could access regular pap smears, that would help greatly with prevention of cervical cancer. Also in South Africa, we have HPV vaccine that is available to all school girls, especially in government schools. And if that program was followed and the girls access it, that would really help with prevention of cervical cancer. Breast cancer is another issue that is extremely common. And we know that obesity actually is one of the major factors for breast cancer. Regular mammograms would be hugely important in prevention of breast cancer and detection of early breast cancer. More women than men have HIV in this country, and HIV prevalence is reaching about 30% in pregnant female population. It's hugely important for women to be tested and be on treatment, because if they are on treatment, they wouldn't be transmitting this disease to their partners and their babies. South Africa has done greatly in the last few decades with managing HIV, and we know that transmission of HIV from mothers to babies has decreased significantly.
All of these interventions that you're speaking about should be services that are available at least to the majority of women at a primary healthcare level. What does it tell you, the fact that that's not necessarily happening?
I think we don't have enough facilities for women to access it. The number of women seen at the primary healthcare level on a daily basis is bigger than can be handled. At times there is no staff, there is no equipment, there is basic things that are absent. So it's a huge issue. And there is other issue that women struggle with in this country, and that's unplanned, unwanted pregnancy, all kinds of pelvic inflammatory diseases, mental health issues, and it's certainly something that can be managed at the primary level.
Let's talk about the issues of unplanned and unwanted pregnancies. Again, having access to family planning services, having access to easy access at least to contraceptives could easily help in terms of dealing with some of that.
Absolutely, and it should be available for everyone, and it is available. However, it's difficult to access at times because from a practical point of view, women may have to wait the whole day to get an injection to prevent the pregnancy. They might not see the nurse a day, and they have to come back. They have to take time off work. So there is just basic stuff that is not practically available. At times, it's also an education that we have to improve on. So creating more of awareness and removing taboos about sexual health and contraception would be really, really helpful. Sometimes women are scared to seek contraception, or they're scared to go and have a checkup because of shame, because they don't want to disclose that they're having sexual intercourse, and yeah, there's lots of issues there.
When you think about the kind of interventions that need to be put in place here, what would those need to look like? Because some of the issues we've been talking about have been known for years now, and yet, for whatever reason, they always seem to fall by the wayside and end up on the periphery in terms of policy interventions and issues that really need urgent attention. And ultimately, we're talking about things that can and have a direct impact on the quality of life for women.
I think that to start with, first of all, is education. So education of girls about their health and what is available and what is important for them and what they should be doing in terms of preventive health. Thereafter is increasing the access to healthcare in rural population and disadvantaged population, and increasing number of clinics and number of staff members, and that would be really, really helpful. And we don't necessarily have to have doctors at the primary health care, but having a nurse who has an ability to refer to a medical practitioner if necessary. So increasing number of staff is very, very important to improve the health care.
Dr. Natalia Novikova, thank you so much for coming onto the show today.